Hello everybody, I hope you're well. I'm Sean Coakley. Welcome back to the Shameless Mental Health YouTube channel. I'm going to cover this one by talking about depression. I've been asked to discuss what is depression and what are the warning signs, what are the trigger signals. I'd like to start by saying that I am not a medical professional in any way, and so these vlogs that I create are my interpretation, my understanding of mental health and are generally based on my own experiences. So I just thought I'd mention that. Obviously these vlogs are usually subjected to research and some degree of stats, etc. before I send them public. So I just wanted to mention that. But okay, so what is depression? What are the warning signs? Well, depression for me and my understanding of that is that it can often be seen in individuals that are displaying signs of grief, unhappiness, fits of crying, low mood. You know, they're generally the things that would indicate that something is wrong. One of the things we have to be able to look for is when you notice in somebody that are reaching that point where they're starting to give up on life. Yeah, they've lost complete interest, and that's a serious warning signal, and it should be at that point that we encourage that person, or we take ourselves to seek immediate medical help and get advice. One of the other things we need to look for is, is that person, or are we losing interest in everyday things such as keeping ourselves clean, our hygiene, our food habits, being able to wash clothes, tidy up after ourselves, that kind of thing. If you start to notice in somebody that's becoming a problem, that is yet another. Now, when we speak about eating habits, that's a tricky one, because you can see extreme patterns at either end, i.e. somebody's either not eating at all, or they can be eating too much. So important to sort of see what's going on there. But it's usually a pattern of behaviour which isn't normal. So that's most definitely a warning sign to look out. A loss in interest in our hobbies and our general activities is another sure warning sign. And that's usually, depression will provide you almost a loss of energy. So that usually then follows on to you not wanting or having the energy to carry on and carry out the usual activities and hobbies that you would do day to day. So yes, sad as that is, it's a very true thing. I think that loss of energy then, and that loss of interest in the things that we enjoy doing, often then lead to almost an emotional breakdown, if you like. So that starts to overwhelm us, and then leads us on to that feeling of negative thought. So we then start to wander into that dark place of thinking more into the small things that we ordinarily wouldn't, and seeing negativity where we wouldn't ordinarily see negativity. So that's absolutely another sure warning sign. So yeah, that feeling that you have no value, or that people around you dislike you, that there has been known to then trigger onto abuse of drugs and drink, etc., to try and fill those gaps. So those displays of abnormality can often be seen if you're noticing all of the other things I've just discussed: the sadness, the loneliness, the lack of looking after themselves, emotional drained, being without energy, not eating properly, just general things like that, then lead to the next step, which is feeling that people around you are not wanting to be near you. And yeah, substance abuse usually is the one thing that usually happens from that point. Mood swings, another obvious, noticeable warning sign of depression. If you're watching somebody move from very quickly between moods, so 1 minute happy to emotional to then sad and angry and then violent, it's just looking for patterns of behaviour that are abnormal. But yeah, mood swings, and of course that as a result then can leave you in a position where you're even more isolated because of what that's doing to you socially, and to the people around you. The one thing I wanted to mention is that when I was at my worst point, psychosis was something that came in and something that I was diagnosed with, and it's not being able to really fully understand and believing that things exist when they don't. You're almost looking for a problem where a problem doesn't exist. The extreme thoughts of people are talking about you that I used to believe that there was people there that weren't there, for example. So that's most definitely a warning sign of depression, and one that that wants immediate attention. So as I've said in previous vlogs, my condition is borderline personality disorder, but there was psychosis at the beginning of that, and that was an explanation. The psychosis was explaining why I was feeling that there was things going on around me that weren't. I believe that people were saying and doing things that they clearly were not. At that time, I believed that they were, but that becomes a clinical sign of depression which needs immediate attention. So that most definitely should trigger an immediate response, and that's a specialist medical diagnosis, which for me was when I was sectioned and held in a mental health hospital. So just that's a sure warning sign, and quite a serious one. So I think the worst of all the warning signs is the thought of death, suicide, and suicidal thoughts, and believing that you're better off not being alive anymore. It triggers an immediate need for prompt action, and at that point, that individual, I'd say, most definitely needs to be very quickly assessed by a medical health professional. And much like me, I had those thoughts and feelings, and the best thing that happened to me was getting sectioned and being dealt with properly and understood, diagnosed. And I've got to be honest with you, and please do remember this, for me, that was the beginning. That was the beginning of my journey to well-being, and for me, that was less than 12 months ago. So I can reassure you and offer hope that if you are that person that's feeling any of those warning signs that I've just discussed through this vlog, then by acknowledging the problem is there, by being able to talk to somebody about it, by getting the right help, you can most definitely get back on the road to recovery again. I hope this vlog's been useful. Take care of yourself. Please subscribe. I will keep making these for as long as you keep wanting me to. And I hope you have a great day. Take care.